So, for those of you who may not have realized that we're living in the year 2025 currently, and that AI or artificial intelligence is here to stay in the EMS world, this episode is going to discuss some of the pitfalls, some of the benefits, and then also how we can use artificial intelligence as instructors, as providers, and also as students to help us be better EMS clinicians and further ourselves professionally.
Attention all units, the air is being held for emergency traffic only.
This is the Pre-Hospital Pulse Podcast, the podcast that delivers high-yield EMS education and real-world opinions you won't find in a textbook. We're here to dissect complex clinical concepts, challenge the dogma, and explore what it really means to think beyond the protocols. The views, opinions, and discussions on the Pre-Hospital Pulse Podcast are for informational and educational purposes only. They represent the perspectives of the host and the guest and do not necessarily reflect the official policy or position of any employer, agency, or regulatory body. This podcast is not intended as a substitute for professional medical advice, diagnosis, or treatment. The clinical concepts and debates presented are designed for trained EMS professionals to challenge dogma and explore the why behind the medicine. All listeners are responsible for adhering to their local protocols, scope of practice, and direct medical control. Always exercise your best clinical judgment in the care of your patient. The first thing we're going to look at tonight is utilizing a tool called Notebook LM to help us with our research. And this can be something you can use as an instructor, something you can use as a student, or something you can use as an EMS provider. You can use it to look up research. You can use it to summarize multiple different research papers on a similar topic, or you can use it as a student. You can use this to drop in different materials that you have for your class and have this tool create you quizzes, flashcards, summaries, mind maps, all sorts of different things are available. And we'll go through each of those a bit later on in the show, but we're going to start with something that is geared towards EMS instructors, and I think all the EMS students or the EMS field providers out there will enjoy this as well. This is how you can use artificial intelligence to help develop clinical scenarios and make those clinical scenarios engaging and beneficial to the student while not taking 4 days to come up with a step-by-step process on how that scenario should run for each individual scenario. So without further ado, I'm going to insert a little presentation made by this AI tool, Notebook LM, discussing designing of patient scenarios.
Hey everyone, and welcome. If you're an EMS educator, you already know just how powerful a great patient scenario can be. But let's be real. Actually creating one that builds skill, boosts confidence, and develops critical thinking, well, that's both an art and a science. Today, we're going to break down the blueprint, a super clear step-by-step framework to help you design high-impact scenarios every single time. Let's dive in. So, let's just be honest for a second. Have you ever run a scenario that just kind of fizzled out? You know the one. Your students go to the motions, they check all the boxes, but there's no spark, no real challenge. And you're left there wondering, did any real learning actually happen? It is such a common frustration, but it's one we can absolutely fix.
And this slide right here really gets to the heart of what we're talking about. Over on the left, you've got rote practice. It's predictable, it's comfortable, but it's really just testing if someone can memorize a checklist. But on the right, that's our goal, a realistic simulation. It's dynamic, it's messy, it's challenging, and it forces students to actually think on their feet. This is how we get them past just the what to do and into the why and how when the pressure is on.
All right, so where do we even begin? Well, every great structure has to start with a solid foundation. And for us, that foundation is the learning objective. Before you even start thinking about the patient or the props or the script, you have got to know exactly what you want your student to accomplish. A learning objective isn't some vague idea floating around in your head. It has to be a precise, measurable statement. And this is, without a doubt, the single most important part of your design. Why? Because it dictates everything else that follows: the patient's condition, the gear you'll need, and, most importantly, how you're going to evaluate the student's performance. If you get this part right, trust me, everything else just falls into place.
So how do you write a great objective? Well, the National EMS Instructor Guidelines give us this fantastic and super simple ABCD model. A is for audience. Who are you teaching? B is for behavior. What is the specific, observable action they are going to perform? C is for condition. What's the setup? What are the circumstances? And D is for degree. How well do they have to do it? What's the standard for success?
Okay, let's make this real with our running case study, a pediatric croup scenario. We can break this objective down perfectly with the ABCD model. The audience, that's our EMS student. The behavior, they will assess the airway and provide oxygen. The condition, they're given a 4-year-old patient with a fever and that classic barking cough. And the degree of success, that's defined as maintaining a position of comfort and getting ready for transport. See? Crystal clear and totally measurable. Okay, so our objective is locked in. Now we get to the fun part, building the world around it. This is where we get to be storytellers, scripting the entire patient encounter to bring that objective to life. The Kansas EMSC Pediatric Scenario Guidebook gives us a perfect template here. For our croup case, we start with the dispatch info. That's the hook that gets it all started. Then, the scene description paints the picture for them. The initial impression gives them that critical from-the-doorway assessment. And then you start layering in the details, the vitals, the history. Each piece is a clue that's guiding the student right toward meeting that objective we set up from the beginning.
Now let's talk about cranking up the realism. This isn't just about what's written on the page, it's about the experience. The instructor guidelines remind us that simple things, some props, a TV on in the background, maybe even some basic moulage, can totally transform a sterile classroom into an immersive environment. And this isn't just for show. It creates pressure and distractions that force the student to really focus.
But what if you don't have a high-tech sim lab with all the bells and whistles? I love this quote from GEMS because it hits that exact problem head-on. You do not need $1 million mannequin. The crucial part is the process. Just have the student do the action. Listen for lung sounds, check a pulse, and then you, the instructor, provide the finding. The real learning is in the doing and the thinking, not in the technology.
All right, so we've built this awesome, realistic scenario. Now what? How do we know if the student actually learned anything? We need a way to measure their performance, because a scenario is only as good as the evaluation tool you use to grade it.
Now, evaluation really comes in two main flavors. You've got formative evaluation, which is kind of like your practice run. It happens during the learning process, and its whole goal is just to give feedback so they can improve. Then you have summative evaluation. Think of that as the final exam. It happens at the very end to see if the student has truly achieved competence. Both are so important, but they serve totally different purposes.
So how do we build a great evaluation tool? Well, the COA MSP guidelines give us some really clear criteria. First, every single item on your checklist has to link directly back to your learning objectives, no random tasks. Second, use a simple yes/no scoring system. Did they do it or not? It keeps things objective. Third, you need to identify your critical criteria. These are the absolute must-do actions to pass. And finally, get it validated. Have your medical director or other experts look it over to make sure it's fair and accurate.
And here's what that looks like in practice for our croup scenario. Just notice how these critical actions, assessing the airway, maintaining that position of comfort, giving oxygen, they're all pulled directly from that objective we wrote way back in section 1. It all connects. It's clean, it's objective, and it leaves zero room for ambiguity.
So the simulation is over. The checklist is filled out. But hold on, we are not done yet. In fact, you could argue the most important part is just about to begin. Let's talk about the debrief.
I really want you to let this sink in for a second. The scenario itself, that's just the catalyst. The debrief, that's where the magic really happens. This is where students get to reflect, to connect their actions to the outcomes, and to solidify what they've learned into knowledge that will actually stick. This is where we turn a simple experience into real expertise.
So how do we do it right? Well, StatPearls gives us a really simple but powerful 3-phase model.
First is the reaction phase. Just let the students decompress. Ask them, how did that feel? Second is analysis. This is where you dig into the what and the why. You're not there to tell them they were wrong. You're asking, what was your thought process right there? Finally, there's application. Solidify that take-home message. Ask, what's one thing you'll do differently next time?
And here's another great tool for your debriefing toolkit, which comes from the instructor guidelines. It's the classic feedback sandwich. You start with something they did really well, then you provide some constructive feedback on an area they can improve, and then you end on another positive reinforcing statement. It's just a fantastic way to make sure that feedback is heard and actually empowers the student.
So here's the bottom line. When you start with a clear objective, build an immersive world around it, measure performance fairly, and lead a really thoughtful debrief, you're not just giving a test, you're creating a powerful learning experience that genuinely prepares your students for the chaos and challenges of the real world.
We have literally covered the entire blueprint, from the initial idea all the way to the final debrief. So now, this last question is just for you. Thinking about your own training sessions, what is the one single change you can make starting tomorrow to take your scenarios from just simple practice to truly powerful, unforgettable learning experiences? Thanks for joining me.
Now that you've seen what the tool Notebook LM can do, or at least one small facet of what Notebook LM can do, next I'm going to show you how to use Notebook LM to generate some sort of content or some sort of material that can be useful to you. So for this particular example, we're going to have Notebook LM find us some research that discusses the utilization of epinephrine in cardiac arrest and how that affects patient outcomes. So you will see I'm going to walk you through this here on the screen, or if you're not watching and you're just listening, I'm going to give a description of what I'm doing, but this is an episode where you would be much better served to watch the video either on our YouTube channel or on Spotify. So we're going to start. We're here at the Notebook LM homepage, and I have only clicked on the Add a New Notebook button. So we have no sources that we want to utilize for this, and we really don't have any idea what kind of sources that we want to use. So we can go here and click on Discover Sources, and we can talk about, or we can tell Notebook LM exactly what it is that we're interested in researching today. We're going to have Notebook LM go out and find us some research related to epinephrine use in a cardiac arrest environment and how epinephrine use in a cardiac arrest affects patient outcomes. All right, so if you're watching, you can see my prompt, but if you're listening, my prompt that I have placed into Notebook LM is I'm telling it to go out and find peer-reviewed research discussing the use of epinephrine in cardiac arrest and how the use of epinephrine in cardiac arrest affects patient outcomes. And I'm also telling it to focus on research that has been released in the last 10 years. And at that point, we're just going to hit submit. And we're going to wait. So this is pretty quick. Some of this depends on your internet connectivity. So if you have a faster or slower connection, that's going to vary on how fast these results come back to you. So as you can see, we already have sources that have been returned. So in our Discover Sources window that's popped up, this tells us that this list provides recent peer-reviewed research, including major trials and meta-analyses that detail how epinephrine affects both overall survival and, more critically, favorable neurological recovery following cardiac arrest. Now, as you see, I didn't tell it that favorable neurological recovery was the most important thing. It just found that itself within the research process. So here we have a list of sources. We have several different sources here that are utilized. You see some are PDF. You see others are a little blue, looks like a web page here. So that is just using a web page itself as the source. And this has 10 sources that it has gone out and found for us so far. So we're going to click import on those sources. Now again, we'll have to give it a second here, and it will read through every one of these sources. And now, if we want to see a little bit of a summary about a specific source, we can click here on the Sources tab. This is going to give us a source guide, and it's going to give us a transcript of the source itself that we can scroll through. And it's going to give us several different main topics here that it pulled out of this particular source. I'm not going to go through all the sources, but you can do this for each individual source. Now here in the center, this came up with a title for our notebook on its own. So it came up with a title of Epinephrine and Cardiac Arrest, Benefits and Controversies. And then we get a summary of all of the data and the conclusions in all 10 of these sources, summarized here in just a few sentences in this center section. Now, cool thing is, I can ask it specific questions if I want to know something specific. So let's say, for example, I want to know, is there a link between epinephrine administration and neurologically intact survival? And this, the cool thing about Notebook LM, it will only use the sources that you have added to pull this information from. This doesn't go out and do just a random Google search to find the answer to the question that you ask. All right, so here we see a summary that tells us that evidence suggests no benefit or even a negative association. There's a lack of improvement in favorable outcome. Observational data on reduced survival. This shows us that several large observational studies have associated epinephrine use with reduced survival to discharge and reduced good neurological survival. And the cool thing about this is this will tell you exactly which source this came from. And then if you click on these will even take you to specific places in that research. And here you have the title of the article that it pulled this information from. As we can see here, this will show you all of the different citations that this is using for each individual paragraph that it is providing back to you. Now, we'll say I don't really want to ask it a whole bunch of questions. I want it to give me a report. Okay? So several different things here you can utilize. So you can do a create your own where you're going to tell it exactly what you want it to do. You can do a briefing doc, which is an overview of your sources with the key insights and quotes. You can have it make you a study guide. You could even have it make you a blog post. Well, since we're a podcast here, let's click on the blog post and see exactly what we come up with. So we're going to click on the little pencil here, and we're going to see that it gives us a description of the report. Now, I'm not going to edit this, but you can edit this to guide the output that it's going to give you. But I'm just going to use the default as an example here. So we hit generate. Now this takes a little bit of time depending on how many sources you have. Typically the more sources that you have and the longer those sources are, the longer this generating the output that you've selected takes. Also, while we're waiting, you'll see over here, I have options for audio overviews, options for video overviews, mind maps. The reports is what we just utilized. I can have it make flashcards here, and then I can even have it come up with a quiz for me. So while we're waiting, we're going to go ahead and have it generate a mind map as well, because that's a cool little tool that I'd like to show you guys. And it's something that's beneficial for all levels, whether you're an experienced provider, whether you're a student who's brand new to the field, or whether you're an instructor and you're looking for ways to present a specific body of information to your students. So the mind map's pretty quick. So we'll go ahead and pull this up here, zoom out just a bit. So you can see that we start with epinephrine use in cardiac resuscitation, cardiac arrest resuscitation, which that's what we told it to go out and look for. Now, we can see that efficacy and outcomes controversy. So, primary benefit, so increased likelihood of ROSC, survival to hospital admission, and 30-day survival. And this will tell you what sources that these came from. So I can go here, I can click on this topic, and it's going to pull up and tell me, discuss what these sources say about 30-day survival in the larger context of the primary benefit. All right. So, and I'm not going to read all this to you, but it's a pretty in-depth summary of just how all of these things are mapped together here in this mind map. But you can do that for any individual blurb on this. So the cool thing is I can click here and expand all of our nodes, and you can see that just how detailed this mind map is with just these 10 sources. So we'll go down here, foundational interventions, so immediate bystander interventions, high quality CPR and early defibrillation. I think we can all agree that those are probably the most fundamental components of a successful resuscitation and cardiac arrest. Here we have some examples of what are some proposed trials that have been discussed in all of these different research papers. All right. So enough of the mind map. Please come back and spend some time looking through this. And I didn't mention yet, but I will mention now that this tool is completely free to use the baseline model. I have the pro version here, but the free version allows you to have up to 50 sources per specific notebook that you're using, which is more than enough for most situations. I had the pro version. The pro version allows me to add significantly longer documents to this and have summaries generated. It also allows me to summarize significantly longer videos, things like that. So to me, it's a benefit to have the pro version, but it's definitely not necessary, especially if you're just wanting to try this out and see how it works. Now, while we were looking at our mind map, we have our blog post that is finished. All right, so you can look over here. I'm going to minimize a couple things here, but our blog post came up with our title. It can restart a heart, but at what cost? 5 surprising facts about the cardiac arrest miracle shot. So, introduction, the paradox of a life-saving drug. And then we go into a discussion here about all the different things related to epinephrine use during cardiac arrest. And then we have our 5 different discussion points here. And as you can see, this is pretty detailed. All right. So again, I'm not going to read you this whole thing. It's just showing you as an example so that you can see what this tool is capable of doing. Now, the other cool thing that this is capable of doing is I can have it generate an audio overview or video overview. So the video overview, that is what I utilize to create the presentation that you were able to see or listen to at the beginning of this podcast. The next artificial intelligence tool that I'm going to discuss is Google Gemini. Again, this is either a free or a paid tool. You can do a significant amount of work utilizing just the free version here. But again, I have the pro version. I utilize this for generating some different scenarios and generating class discussion topics and things like that in real time during paramedic classes. The students really enjoy the interaction with this particular tool. Now that we have our Gemini pulled up here, I'm going to start out with the creation of something that's called a gem, G-E-M, okay? So that is what Gemini utilizes or refers to as what other artificial intelligence tools may call an agent or something along those lines. What I have here is one that I have created to be an EMS instructor. So go through a little bit of the components of creating this here. First of all, you have the name, so you're just going to name your gem. I've named this one EMS instructor. And then I have the description here. So this gem serves as a seasoned EMS instructor for all levels of initial or EMS initial education. And then here I have my instructions. So the instructions really the key component of this gem and getting it to do what it is that you want it to do. So in the instructions, I have told this gem that it's going to function as a seasoned EMS instructor that is responsible for teaching all levels of EMS initial education, from EMR through paramedic. I told it that it will have to utilize the latest version of the National EMS Scope of Practice model, as well as the latest edition of the National EMS Education Standards to help shape your responses. And before generating a scenario, you should ask what level the scenario should be built for if it is not specified in the request. And I said that if you are instructed to develop a patient care scenario, you should know that students are evaluated using National Registry style assessment and skill sheets for their applicable licensure or education level. Now, I know that those no longer really exist, but they are a decent framework to base the output of a scenario that this may generate on. Right. When applicable, you will provide peer-reviewed research to support your claims. Simulated patients should have realistic signs, symptoms, and presentations. These simulated patients should also respond appropriately to the treatment that's provided by the student. And since I do most of my initial education in the state of Georgia, I have specified that the students will be evaluated using the Georgia Office of EMS simulation evaluation forms. Standard equipment available includes LifePak 15, GlideScope Go 2 video laryngoscope, and other applicable EMS equipment. Preferred induction agent is ketamine unless contraindicated, and the preferred paralytic for use is rocuronium unless otherwise indicated or unless it is contraindicated. Now, these are just some preferences that I have added in here for my specific class, but you can create that however you would like or however you see fit. Now, down here in the knowledge category, I've uploaded 3 PDF files. So the first PDF file is the 2023 EMS standards. I've uploaded the National Model EMS Clinical Guidelines version 3, which was the latest version at the time that I created this particular gem. And then I've also updated the 2023 EMS standards final update that includes all the latest releases to the EMS core curriculum document here. I just went out, found those online, downloaded them, and then uploaded them here into the knowledge base. And what that does is that allows it to pull from these with every single use of this gem. Once we have created our gem, it'll show up over here on the side and you just click on it. And every time you click on it, it will create a new chat with that particular gem. So since we are on the topic of generating simulations, we're going to have it generate a simulation scenario for us in real time so that you can see just how fast this works and how it responds. So my paramedic students are getting ready to start their airway management unit, so we're going to have this generate a scenario where a paramedic student must perform basic, advanced, and crash airway procedures. And we're going to tell it that the patient should be a trauma patient. And we're going to hit go. And you can see here it's doing a little thinking. It'll tell us just a second. It's going to go through an analysis process where it goes back to the knowledge base and to its instructions. As you can see here, you can see that it says examining the core documents, and now it's going to start telling us that it's designing a realistic trauma case. Right? We're going to conceptualize our patient deterioration. It's going to design that deterioration. It's going to develop the trauma patient. And as it goes through all of these different steps, it's building out the whole thing. And once it gets to the end, now here we are, you can see that we have started to output our scenario. You can see, so this is telling us that here's a scenario designed for the paramedic student focusing on a trauma patient requiring basic, advanced, and crash airway procedures. Tells us that this scenario is designed to test the paramedic student's ability to manage a progressively difficult airway culminating in a can't intubate, can't ventilate situation, forcing a surgical airway. The student will be evaluated on National Registry Airway Management Skill Sheets, the Failed Airway Algorithm, the Surgical Cricothyrotomy Skill Sheet, as well as Georgia EMS Simulation Criteria. So our airway trauma scenario, the unseen road. So it starts out giving us our dispatch information. So Paramedic Unit 7, time 0230 hours, location 1400 block of Old Mill Road, winding 2-lane rural road. Dispatch. You're going to respond code 3 to a single vehicle MVC, car versus tree. Unknown injuries. Caller reports one male patient, unresponsive, trapped in the vehicle. The line is open and the caller sounds frantic. Gives you the weather, dark, moderate rain, 45 degrees Fahrenheit. We get our scene survey. So as your students arrive on scene and they want to know what they see, this is exactly what they see. You arrive to find a single sedan with severe front end and driver's side damage. It's wrapped around a large oak tree. The scene is dark, it's lit only by your headlights, and a single porch light in the distance. Fire rescue is just arriving with you, and law enforcement is not yet on scene. The driver, a male in his 40s, is slumped forward over the steering wheel, airbags have deployed, the vehicle is stable, and there's a significant spider webbing present on the driver's side of the windshield. So now we move into our initial patient contact and our primary survey. So your paramedic student is instructed to be the team lead and to manage the airway. The patient is extricated by the fire department and moved to your stretcher in the back of the ambulance. So your patient, you have a 40-year-old male patient. Your general impression is that the patient is unresponsive, is pale, is diaphoretic. There's significant facial trauma with ecchymosis and swelling around the nose and the mouth. Well, that sounds pretty bad. Massive hemorrhage. We have no active massive external bleeding that's noted. Airway. We got loud gurgling respirations. Right? The oral pharynx is actively filling with dark blood and saliva, and his mandible appears unstable and flail. Right? So this should be sending off red flags in your student's brain to tell them that they're going to need some emergent airway management at this point. Breathing. Tachypnic. Is at a respiratory rate of 30. It's shallow, it's labored. As SpO2 on room air is only 86%. Carotid pulse is strong and rapid at about 130 beats a minute. Radial pulse is present but thready. This should allow your student to get the idea that this patient is in a shock state. Now, we have a GCS of 5, and it even breaks down GCS. So we have I's of 1, V of 1, and an M of 3, a flexion. Our pupils are unequal, with a 4 millimeter on the right and 2 millimeters on the left. Both are sluggish. He's cold to the touch and wet from the rain. So even worse for our shock scenario. Initial vitals. You don't give them these vitals until the student obtains them, but here's what your student would get when they obtain their initial set of vital signs. Heart rate 134, sinus tach, blood pressure 98/60, respiratory rate of 30, SpO2 is 86%, end-tidal CO2, waveform is erratic, reading is 28 millimeters of mercury, and our blood glucose is 110 milligrams per deciliter. Now, we move into the scenario flow and the expected interventions. So our basic airway management. The student must recognize and know that they have to immediately address this compromised airway. So here are your expected student actions. So 1, they should immediately prepare their suction. They should manually open the airway using a trauma jaw thrust. They should suction the oral pharynx, and they should attempt to insert an OPA, or an oral pharyngeal airway. If they do this, your simulated patient response should be that the suction clears the airway for 2 or 3 seconds, but it rapidly refills with blood. OPA is difficult to seat because the mandible is unstable. Patient's SpO2 is dropping, now it is at 82%. The gurgling continues. The student must at this point recognize that those basic airway adjuncts are inadequate to provide appropriate oxygenation and ventilation to this patient. So now, our instructor cue is when the student applies a BVM, we're going to tell them that they're getting a poor mask seal because of the facial trauma and the unstable mandible, that they see very minimal chest rise, and that the abdomen is distending. SpO2 is now at 79%. Now, we're going to go to advanced airway management. Our first attempt potentially could be a supraglottic airway. All right, so if they opt for a rescue airway or a supraglottic airway like the iGel or the King or any of the other ones that are out there on the market, you're going to get a loud air leak from the mouth, and blood begins to bubble up around, around the cuff or around the distal end of the device. End-tidal is absent, SpO2 is dropped to 75%, and there's no chest rise with the device. All right, now attempt 2. Or if they didn't start with a supraglottic airway, they would go straight to this endotracheal intubation or drug-assisted airway or drug-assisted intubation, DAI. All right. So what are the expected student actions here? They declare a need for the DAI RSI, have their partner prepare the equipment, prepares for a SALAD technique or suction-assisted laryngoscopy and airway decontamination technique, pre-oxygenate the patient as best as possible. SpO2 remains about 80%. Administers induction and paralytic agent of their choice. So induction here, as we've told it, it's going to tell us to use ketamine and rocuronium, but you would allow the student to use anything that is appropriate. Our response to that is the patient becomes apneic. Right? When they insert the glide scope, their camera lens is immediately covered in blood. Can't identify any landmarks. Your intubation attempt has lasted for 30 seconds. SpO2 is 68%. You must abort. They're going to attempt to ventilate again with the BVM. And you have no chest rise, no end-tidal waveform. SpO2 is dropping fast. And then here's where they have to recognize that they're in a crash airway procedure situation and they must perform a surgical cricothyrotomy. All right, so again, I'm not going to continue to read all of these to you, but this will go through and tell you every piece of what they should be doing as the student and what your simulated response would be. Now, this is what I like to think is the most important component of this whole scenario is the debrief and the key evaluation points. So this gives you some questions to ask the student and to talk with the student and their team about after this is over. And it also, did they follow a logical progression? And when we got to the surgical airway point, did they make that decision in a timely manner? Did they identify the appropriate landmarks? Did they perform the procedure correctly? Was the tube placement confirmed immediately and correctly? And then here's some different critical thinking and scope of practice links that discuss what it used to base this scenario on. So now, let's say your student did a little something different, and maybe they are an advanced practitioner and not an initial education student, and is someone that would have likely gotten this intubation. So we're going to say that the student was able to intubate the patient with endotracheal intubation, but we're going to tell it to regenerate the scenario from that point, but to come up with a reason that they will need to perform a surgical airway later in the scenario, because maybe that is the specific skill that we need to test. All right, so this is going to come up with all of the rest of the scenario from the point where we got to the intubation earlier in our original scenario that was generated. So we'll give it just a second here to finish thinking. So we go back here, scroll back down. We've got the basic airway management, and we've got the intubation here. They've got a great waveform. They've got a good end tidal reading. They confirm the tube depth. They've got SpO2 that quickly climbs to 99%. Now, at this point, we're going to identify a compromised larynx or a laryngeal fracture. All right. After we've identified that, ambulance hits a pothole that violently jars the patient and the crew. Transport ventilator alarms low pressure. You look at the monitor, end tidal waveform has vanished, and it's replaced by a flat line. SpO2 is dropping rapidly. They do the dope mnemonic. They realize that the endotracheal tube has been displaced. Disconnects the vent, deflates the cuff, attempts re-intubation, doesn't get the re-intubation, and now they have to proceed with performing that crash airway. And then again, we get our debrief points. Right. So again, this is an excellent tool. Now, if I were a student and I wanted to use this to generate myself scenarios to practice, this is an excellent way to do that. And you can do these just as tabletop, or if you're in the classroom, you can use this to generate a scenario when you're going through just your rote skill practice, so that it's not just doing the task with nothing, no kind of scenario based around or based on what particular skill you're doing. You can tell it to generate you a scenario for a specific skill that you're working on, so that you have a little more total picture of what you're working on. As an EMS provider, this is a tool that is excellent and can be used for evaluating research. It can be used for coming up with scenarios where you would use those, high risk, low occurrence skills that we all should spend more time practicing. So if you're an EMS student or an EMS provider or an EMS instructor and you feel like this content has been helpful to you, or you think that some of the things that we have talked about here could be useful for furthering your career in EMS, or helping you study, helping you become a better educator, or helping you become a better provider, please give us a like, a share. Follow us on our YouTube. We have Instagram. Follow us. Like, share content on Instagram. We also have a TikTok going. So like, share our content that we're posting on there, so you can help get this information out to all of those people who may benefit from hearing this. Thank you for joining on tonight's episode, and we look forward to providing you with more content in the next week. Until we see you again, be safe out there and do the best that you can for your patients. Thank you for listening.